Hi, my name is Raquel and I did my case study on varicose veins. So for my introduction, the patient is a 54-year-old male. He came into the doctor's with swelling, bulging veins in his lower legs. He noticed the swelling about 5 years ago. He has a history of low blood pressure. He has no family history of vein issues. He suffers from restlessness, leg cramping, and feeling tired and heavy after a long day. He works as a pharmacist and stands for an extended period of time. The labs all came back normal. His presenting symptoms was when the physician examined him. He could physically see bulging veins on both lower legs. The lower extremity venous Doppler was ordered to rule out blood clots and vein obstruction. On the ultrasound, it showed a normal blood flow in both legs. On the color Doppler, it showed venous stasis, which is decreased blood flow. Small clots were also found in both ankles and feet. So, to explain the pathology of varicose veins, they are enlarged, bulging, superficial veins that can be felt beneath the skin. They're generally larger than 3 millimeters in diameter. The most common location for them is the inside of the calf or thigh. Less common locations that you can have varicose veins are the vulva, the spermatic cord, which are called varicoceles. You can have them in the rectum, which are called hemorrhoids, and in the esophagus. They are found in 10 to 20% of men and 25 to 33% of women. You can be more at risk to develop varicose veins if you stand for a prolonged amount of time. If you have a tumor in your abdomen, it can cause excessive pressure to your lower extremities. If you're obese, if you're pregnant, or if you have chronic constipation. And these are just a couple. Having varicose veins also puts you at a higher risk for developing a thromboembolism. Varicose veins are more common in women than in men, and they're more common in the lower limbs versus the upper limbs. You are more at risk if you're pregnant, older in age, and standing most of the day. So, physiology, varicose veins are caused by weakness in the vein wall and the valve loses function. Gravity is working against veins, and this causes them to enlarge. Over time, they become more elongated, twisted, and pouched. They may be seen superficially as twisted veins in the lower extremity. Varicose veins are categorized by two types, primary and secondary. Primary varicose veins are caused by intrinsic valvular incompetence and has no known cause. Secondary form is caused by either an outflow obstruction, a valve obstruction due to a blood clot, or because of an arterial venous fistula. There's a couple of options for the treatment for varicose veins. Back in the day, it used to be a large open surgery, but now we can do a minimally invasive approach. So this patient in particular underwent an endovenous laser therapy. So this involves placing a laser fiber into the vein to seal the vein. This improves circulation. Other procedures you can do is sclerotherapy, radiofrequency ablation, and ambulatory phlebotomy. And then a surgical procedure like vein stripping may also be performed. So sclerotherapy uses a chemical, and it is a great alternative to surgery. Radiofrequency uses heat to ablate the vein. And ambulatory phlebotomy is a mini surgery that removes superficial veins through small incisions in the skin. And vein stripping is a surgical procedure where veins are pulled out of the body. If one treatment does not work effectively, there are many more to try. Also, regular exercise and avoiding long periods of sitting or standing can help prevent the development of varicose veins. So, kind of in summary, varicose veins are most common in women around 40 years old. They are superficial twisted veins, most commonly found in the lower extremities. The chances of suffering from varicose veins increases with pregnancy and prolonged standing. There are many treatment options ranging from less invasive to surgical options. For our protocol, when a lower extremity venous ultrasound is ordered, the primary concern is searching the deep veins for the possibility of a blood clot. After imaging the deep veins from the groin to the ankle, the technologist will ask the patient where the area of pain is. This is when varicose veins are imaged in the exam. A differential diagnosis, there's a couple that can also cause lower leg swelling. Some include a femoral hernia, inguinal hernia, femoral artery aneurysm, or lipoma. And so for this, I couldn't really find images that were normal of varicose veins since they're not routinely imaged. But if they're a superficial vein less than 3 millimeters in diameter, they are, and if they compress, then they are normal. So these ones, I found two different examples of dilated great saphenous veins. So you can see they measured it in trans and then in long. And the second picture, you can see in trans again, and then this is after they fixed it. You can see how much thinner the vein is, and you can still see the edema on the top. And then the last picture is showing the pulse wave of the greater saphenous vein as well, and it's showing retrograde flow, which is an example of varicose vein of the flow going the wrong direction. And these are my references. And thank you so much for watching my presentation.